Coronavirus case numbers are surging and the timing couldn't be much worse. Kids in Maine and all across the nation are heading back to school.
Efforts to control the spread of the virus are complicated because kids under the age of 12 aren't eligible yet to receive any version of the coronavirus vaccine. And that is setting the scene for fights over mask rules.
And that national debate is trickling down to the smallest of governments, school board meetings. Local leaders are walking a tightrope, trying to keep kids safe while managing parents' expectations through all of this. Good evening, and thanks for joining us on News Center Maine at 5:30. I'm Amanda Hill.
And I'm Chris Costa. First, let's get some perspective on what's happening with the pandemic right now in Maine. Our state reported 287 more people tested positive for COVID-19 today. That is the largest single-day increase since May. Yesterday, the Maine CDC confirmed that the overwhelming majority of cases are coming from the quick-spreading Delta variant. And our hospitals are feeling the strain. Right now, 125 people are in the hospital with the virus. That's roughly double what it was a week ago. 60 people are in critical care. And this evening, the director of the Maine CDC confirms just 39 ICU beds are available in the entire state.
And some Maine schools are already returning to class and battling COVID cases. Students in Van Buren District Secondary School and at Caribou High School are taking classes remote after staff or students tested positive for the virus. Watching those COVID numbers surge, many school districts are taking a second look at their fall plans. These school districts actually changed course. They're now asking for masks in the classroom. That includes districts based in Farmington, Rumford, and Lisbon. Masks are also back at Herman School Department and Brewer. The superintendent there says he can't ignore the surge in new COVID-19 cases.
We had some local cases of the virus as more people began to work on campus in August and students started to return for pre-seasons and other activities. And so what was happening statewide started to also happen here in Brewer.
Tomorrow, Lewiston Public Schools Committee will hold an emergency meeting on whether to require masks or keep them optional.
So if you're a parent in a district where masking is optional, you may be wondering, how effective is it for my kid to wear a mask if no one else is? For the answer, we turn to Northern Light Health's COVID-19 Senior Physician Executive, Dr. James Jarvis.
Yeah, that's an excellent question, and I know one that's making the rounds on social media.
If my kid is the only one in their class wearing a mask, how effective is that mask?
We can't really quantify that. That would be a very difficult study to do and provide.
But here's what we know for a fact. A mask protects both the person wearing it and the people around them, according to the US CDC, the World Health Organization, and Dr. Jarvis. Regardless of the type of mask, they block droplets from the wearer's nose and mouth from escaping and spreading. Those droplets are how COVID-19 spreads from one person to the next.
It just protects that from being spread directly in front of you. It also protects you from breathing them in if somebody else were to cough, sneeze, or talk loudly in front of you and spread that. So we know it is a two-way protection.
That's why Northern Light Health is encouraging schools in Maine to actually implement the CDC's recommendations that everyone over the age of 2, regardless of vaccination status, wear a mask indoors in schools.
That protects everyone in the room to a level that wouldn't be done if even just one person wasn't masked.
So one of the common concerns from parents is, how will wearing a mask affect my child's social development? Dr. Jarvis said last year during the pandemic, kids were very resilient during the school year and had this to say about masking.
And really what masking can help do is prevent the spread from person to person, and therefore we will be able to continue to have in-person class during the entire school year, and that's important. If we want to talk about disruptions of socialization, it is having your child go to school, then have the school shut down, and then the child going back and having that continue throughout the school year. It is much better for us to start off with a clean slate, doing all the preventative things we can do that's possible to keep our children safe and keep them in school for the entire school year.
And districts have a new tool to guide them when making back-to-school decisions. A new statewide dashboard estimates the vaccination rate of 12 to 18-year-olds in each school district. Some of the highest rates are in places like Ellsworth and Wiscasset, with more than 95% vaccinated. On the other end of the scale, districts like Lisbon Public Schools have a vaccination rate below 25%. In Cutler, it's below 20%.